There are so many details to Medicare that it can make for a lot of questions. This show is dedicated to answering those Medicare questions one by one and serving as your resource in the modern Medicare world. This is Medicare Made Simple with Kevin Geiger.
Welcome to Medicare Made Simple with Kevin Geiger of Carolina Medicare. You can always find out more on the website, carolinamedicare.com, carolinamedicare.com. I'm Mark Elliott. If you have any questions about the open enrollment period, or as Kevin likes to call it, the annual election period, but most of us, we just know it as open enrollment. Every October 15th through December 7th is the Medicare open enrollment, and that is moving from Medicare Advantage to Medicare supplements or vice versa. But a lot of it is about prescription drugs, Part D, because drug plans change from year to year, so you need to make sure that the drugs plan you had this year is going to be the right plan for you next year, and that's what open enrollment is all about. If you have questions about that, it's 843-868-MEDI, and there is no cost for this at all. Kevin is not getting paid by you. He gets paid by the insurance company. He is independent, meaning he's not answering to board of directors or an insurance company. He's looking out for your best interest and then searching for the best fit for your situation. Again, that number is 843-868-6334. Kevin, welcome to the program. How are things at Carolina Medicare? Because now you're about in the middle of the annual and open enrollment period.
Yeah, this is the absolute busiest time for us. I mean, we're feeling at least 10 or 20 phone calls a day, people calling in, trying to evaluate things, and they hear us on the radio show. They go, they're asking our team or asking me, saying, are we in the right plan? Are we doing the right thing? Should we be making changes? So we're extremely busy. On top of that, we're still dealing with our current clients, doing reviews with them, trying to get that done to make sure that we're making the changes for them before December 7th, so they're ready for the new year. Whether they're staying with the current plan or making the changes to the plan. So, yeah, this is a busy time for us. But we love what we do, and if we can help each person here in the Low Country to make the right decisions with Medicare, that's what we're here to do, and we'll just keep doing it year by year.
So is there anything that you have seen this year in this open enrollment period? Again, it's October 15th through December 7th, and the dates don't change. They're kind of written in stone, it seems. Every year that's your opportunity to make some adjustments with Medicare and the prescription drug plans and the like. Are there any similar things you're running across that maybe caught you a little bit by surprise, or things that happened that people were surprised by?
Yeah, I'd say the number one thing, and of course we see this every year, is brand loyalty. People get so stuck in brand loyalty. We always talk about either you're a Ford guy or a Chevy guy, right?
Well, that's an easy answer.
Brand loyalty,
it's Chevy because it's about Camaros and Corvettes, not about the Mustang.
Exactly. So brand loyalty can sometimes cloud people's judgment on making the right call as far as what they're doing, because they go, well, I'm good with ABC company and this has been providing all the coverage and I'm happy with it. And then we sit down with them and we go, hey, we ran the stuff, and you're actually paying this much money extra a year on top of your cost of your plan. So really, in the end, you're paying $2,000 or $3,000 a year for your total cost, for example. But if we switch you to GBA or whatever you want to call a company out there, and we made that change, we're now going to find a way to cut that cost by maybe half or more because you're covered more with your doctors or your prescriptions and your Part D plan and things like that. So you got to be conscious of that stuff, and don't get stuck with loyalty to a company because they don't care whether you stay with them or not. The fact of the matter is they're in business to make money and at the same time provide insurance coverage. So make sure you're doing right for yourself. And then I'd say probably a big one that I've been seeing a lot of this year is people get so stuck on the monthly cost with their Part D drug plan that they don't look at what the overall cost is for the whole year. What do I mean by that? Well, here's the prescriptions I'm taking. I've got these 6, pills I'm taking a year, and we plug the numbers in, and we find out based on their coverage, they're actually paying this much money. And let's just say it's $1,500 a year with the current plan they're with, even though that cost is cheaper or maybe higher, whatever the case might be, versus going with another plan which has better coverage for the prescriptions they're taking, which could cut their bill in half or more. And we're seeing that a lot, and we have to have this, I call it this educational moment, saying it's not about what the monthly cost is, it's about making sure that what you're currently taking is being covered as best as it possibly can, because that's where it's going to save you money. And, of course, I always say that the one big one is always no one ever looks at their annual notice of change. That's probably the number one thing that I see, not knowing what's changing their current plan. And we sit down with them, we go through it with them, and we make sure that they fully understand that stuff. So there's a lot of things happening. And I would say what we're seeing a lot right now is everyone is leaving the North, it seems like. And we talked about this before in the show, but we are seeing a lot of people moving from the North, and they've got to start looking at what their current plan is and understanding that even though their current plan moved into the new state for you, so they switched the coverage from Ohio or Illinois into South Carolina, that doesn't mean that that's the right coverage or the best plan for you. And we're seeing across the board that we're cutting people's costs by 25 to 50% on their plans, whether it's a supplement plan, a prescription plan, or Medicare Advantage, for example. We're cutting costs left and right and finding better coverage inside this stuff. So don't get stuck and get in your own way. Make sure you're doing the right things, and we're evaluating the plans for you, because that's what we're here to do. And again, our services are free. Insurance companies pay us to do this, Mark. So whether you go through the insurance company directly or through us, the premiums do not change. So why not utilize a free service to make sure you're doing the right things and making the right decisions?
Yeah, absolutely. It makes sense. 843-868-MEDI is the number if you'd like to talk more about Medicare questions that you have. Right? It's your opportunity to talk with the team at Carolina Medicare. 843-868-6334. And as Kevin said, there's no cost for this. Kevin's here to help guide you. He's independent, so he can search all of the insurance companies and find the best situation for you. 843-868-6334. And you can't just call him and say, hey, what do you think is the best company for me, Kevin? Well, he doesn't know, because he doesn't know your situation. There is you've got to do a little research here. So you come in and you chat with Kevin, or you just do it on the phone. Here's my situation. Here's what I've got. Kevin researches, gets back to you. I mean, there's a lot of different options here available for you. 843-868-6334. I'm Mark Elliott, Kevin Geiger with Carolina Medicare. You can find out more on the website, carolinamedicare.com, carolinamedicare.com. How often do you run across, Kevin, someone that is eligible for Medicare, but hey, I'm still working and I've got my company insurance, so I'm not even going to sign up for Medicare? I asked you about a friend of mine that was an insurance agent last week on the program, and he was 65, and I'm like, so you signed up for Part A of Medicare? And he's like, no, I've got my own insurance. And I'd ask you about that, and you said, well, it might make more sense because there's no cost. Why wouldn't you sign up? And it might help you when it comes Part A is hospital coverage. It might help some of the deductibles and the like. But how often do you run across someone that is eligible for Medicare, but they stay on their group health insurance through work, not realizing that they might be paying more for less coverage?
Yep. Oh, gosh. I would say that happens quite often. And we actually had a nice lady that called in last Thursday, and she heard us on the radio show, of course, and she said, hey, you were talking about the stuff the following week where I was a little curious about this, because I'm currently have my plan that I'm on now with the company. I'm paying $450 some a month for this insurance, which is quite high. But I was starting to question, should I be switching and getting onto Medicare, or should I be staying on our current plan? So we ran the numbers for her. We said, hey, we can get you in the Part A. That's zero cost to you. We can get you on Part B, $144 basically a month to have that stuff. And then we looked into a supplement plan for her because she was eligible. She had just turned 65 recently. And so we were able to look at the supplement plan, and we put her on the best supplement plan we could put her onto. And then in the end, we ended up saving her roughly about $100 a month, and she had way better coverage than she was getting from her insurance plan from the company. So we made the changes for her. She finally realized, you know what, maybe this made sense to do this. So like your friend that we were talking about last week, in his situation, he might find out it's cheaper to get the Part A and a supplement plan and have way better coverage than just keeping the private stuff. Because let's face it, private has a lot of quirks to it. We all know we have deductibles we have to meet. After that, we have co-insurance we have to deal with. So by the time you fork out all this money, the insurance company might be paid over a few bucks. Meanwhile, you paid everything out of pocket. So, if you're on a Part A and a Part B with a drug plan, and let's say you get what I call the cream of the crop, the G plan with a Medicare supplement, having 100% coverage on all this different stuff, it could save you quite a bit of money. And especially if you end up getting hurt or in the hospital, you're definitely going to see a difference as far as what you're going to save. And that way, again, I always say, we don't want to destroy your retirement savings. You worked hard to save it. The last thing I want to see you do is giving it to a hospital or something like that. That's just the last thing you want to do. So coverage is the most important thing for anyone that's nearing retirement or in retirement.
And I think that's one of the more surprising things that I've learned doing this show with you. Because I've always heard, well, you've got a job, you've got insurance through your job, you can just sign up for Part A because it's free, but don't worry about the rest of it because your insurance at your job is probably really good. This is the first time I've heard, well, maybe you could do better through Medicare. That's really interesting. 843-868-6334. Let's say you're 68 years of age. You're still working. You're running all your insurance through your company. And you're like, hey, I think I never knew that I could have maybe even a better option that might save me money. And I'm obviously, if you're working at 68, you would like to retire at some point, I'm thinking. And if you save a little bit money month by month for your insurance, then maybe that's a little bit more travel money or fun money you would have in retirement. 843-868-MEDI, 843-868-6334 to talk with Kevin Geiger of Carolina Medicare. You know, we talk a lot about the do-it-yourself era that we're in. And there's a lot of people that are managing their finances on their own, managing their 401ks on their own, and then say, you know what, I think I can handle my Medicare on my own. Do you ever, and I can't believe anybody would ever make a mistake doing things on their own, but do you run across folks that make mistakes doing it on their own?
Absolutely. Yeah. During the open enrollment period, we see a lot of people jumping into plans on their own because, it's a silver sneaker plan. I want to get my free gym membership. And then they jump in the plan not realizing all this co-insurance and limits are way higher and there's less coverage on the dental and there's all these other things they didn't realize, and they jumped into the plan. And it's ironic because we end up getting a lot of phone calls in January going, I think I made a mistake. Well, the great thing about January is, you get January through March where you have a chance to make one change, an update. And so we see a lot of that in January where people go, I screwed up. I made the wrong call. I should have called you guys, but I felt like I could just do this on my own because how hard could it possibly be? So, great news is if you make a mistake, picking a plan during this open enrollment period, you have one, I call it Band-Aid, where you can fix that problem and cover it up and kind of put yourself in a better situation if that were to come in January. But, after March, basically, you're pretty much stuck with what you have. So rather than making those mistakes, that's where we're here to basically sit down with you or even over the phone and evaluate what's going to be the right plan for you and making sure you're having the coverage you need. So you don't end up going down that route.
All right, so here's a scenario for you that I think plays into this whole conversation we're having, Kevin. And so I had a stent put in my heart in July of 2020. And I was walking, playing golf, and my chest was getting tight. And then my jaw would hurt. And they said, well, maybe you have acid reflux. I took medicine for 30 days. And I go, how'd that work? Well, my chest pain went away, but my jaw still aches on the uphill portions. And it goes away on the flats and the downhills. So I didn't understand all of that, but they said, looks to me like you need to go see a heart doctor. Well, I have a stent put in within 2 weeks. So then I get the bill, right? And so I asked my HR department at the company, I said, all right, so how much do I owe on this? What is my out-of-pocket max? And they said, well, it's $1,500, but there are some, percentages that you might have to pay over and above. And so I don't have any clue what my plan covers at my place of employment. When something happened, I went to HR and said, what do I need to know here? How often do people actually know whether it's their company plan or their Medicare supplements or Medicare Advantage and all those things, do we actually know what our plan offers? I mean, that's something that's probably important to know, isn't it?
Yeah, and I would tell you, if I asked a group of 10 people in a room and I said, right now, tell me what your coverage is in their plan, I guarantee you'd be lucky if you get one person that knows half of what that plan has in it, which is shocking, right? Because it's probably one of the most important things you better understand because it's going to have the biggest financial impact on you if you end up getting sick.
We're never going to get sick, though, Kevin. We're never going to get sick.
Right?
Ever. We're going to be in great health until we're not.
Exactly. But the fact of the matter is it's a law of numbers, right? And it's something's going to happen at some point. So you better know what your coverage is in the plan. And if you've been in the private world of, private insurance before Medicare, you understand this a little bit if you ever end up getting sick or someone in your family gets hurt or something like that and you go, wow, here's a $3,000 bill I got to pay or a $7,000 bill for this. Or you end up having a baby nowadays. Most of these plans don't cover any of that stuff. And then end up getting hit with these massive, insurance bills after the fact. And so you got to really understand the benefits inside there. So sit down, read through it, and they've made them so easy nowadays to kind of understand, at least to an extent, at least you can kind of get the gist of it. But if you don't understand it, that's what we're here to explain. But make sure you got a better understanding of that stuff rather than knowing more about your cell phone bill. Because let's face it, insurance cost is going to be probably your second most expensive expense in retirement. So you better fully grasp what you have.
So if you think about it, Social Security started in 1935 under FDR. Well, Medicare started in July of 1965 under Lyndon Baines Johnson. So think about it. We're 55 years into Medicare. It's not the same plan it was in 1965. Everything is changing, and it changes all the time, which is why Medicare put in this open enrollment opportunity for people every October 15th through December 7th, and it can get complicated. Now, the idea is that Kevin is going to make it a little bit simpler for you. Once he understands your situation, then he goes and does the research for you and says, hey, here's option A, option B, or here's choice 1, 2, or 3. You make the decision, but I think these are the 3 best options. He's not going to tell you have to do anything. It's your decision at the end of the day. But if you do have questions, why not take advantage of this free service that Kevin Geiger and Carolina Medicare offer to everybody? 843-868-MEDI, 843-868-6334. Why wouldn't you? There's no cost. Make sure you're not wasting money that you could be traveling on, having fun with. That would be a great opportunity for you. 843-868-6334. And I do want to encourage you to check out the website, carolinamedicare.com, just to learn more. carolinamedicare.com. So we're halfway through the program today. We got a lot more Medicare questions, and Kevin's got a lot more Medicare answers for us when we come back. This is Medicare Made Simple with Kevin Geiger of Carolina Medicare.
You're listening to Medicare Made Simple with Kevin Geiger. Online at carolinamedicare.com.
It's the time of year to review Medicare plans, and the Medicare plan that was right for you last year might not be right for you this year. With so many moving parts, many things can change, and last year's good provider might not be as good in 2020. Coverages, co-pays, prescription formularies. You need somebody you can bring your questions to. Someone independent. Someone who puts your best interests ahead of their own. Let Kevin Geiger of Carolina Medicare be that person. Kevin can help you review your options for 2020. To set up a one-on-one visit, call the office at 843-868-MEDI. That's 843-868-6334. Or sign up for one of Kevin Geiger's upcoming webinars at carolinamedicare.com. That's carolinamedicare.com. Let's get you settled into the right Medicare plan for next year before December 7th rolls around. Kevin Geiger at Carolina Medicare. Call 843-868-MEDI or visit carolinamedicare.com.
You're listening to Medicare Made Simple with Kevin Geiger. Online at carolinamedicare.com.
Glad you're with us for Medicare Made Simple with Kevin Geiger of Carolina Medicare. I'm Mark Elliott. Carolina Medicare, serving the Low Country, the Charleston area, Myrtle Beach, really the entire state of South Carolina. Now, if you have moved to South Carolina from, let's say, up north, because you're getting ready to freeze to death, if you're in Illinois and Iowa and the Dakotas and all of those places where it's really cold in the winter, and you're like, I'm tired. I've been beaten down by these cold winters up north. I'm moving to Charleston, South Carolina, Myrtle Beach, Hilton Head, what have you. You've got to make sure that your Medicare travels with you. Kevin and the team are here to help you figure that out. It's 843-868-MEDI, 843-868-6334. Kevin can help you answer that question and make sure you have the right coverage if South Carolina is now your new state, because it's not necessarily the same as it was in your old state. So it's a great opportunity for you to find out more. With open enrollment, and this is the annual election period, October 15th through December 7th, same time every year. With open enrollment, what are some changes, Kevin, that you've seen coming to new Medicare Advantage plans for 2021?
Well, I'd say the biggest one, Mark, that we're seeing is revolving around insulin for diabetics. Trump renegotiated the terms with the pharmaceutical companies a few months back. And so this is a big piece that people need to realize with the Part D plans, that, which Part D is also a part of Medicare Advantage if you have a prescription drug plan built into it. But it's going to be $35 per month for 30-day supply. So 1/3 of the Medicare beneficiaries are diabetics. So this is a big piece of the puzzle that many of them have to realize that could save them a ton of money. Now, the current prescription drug plans don't have to incorporate this, and so you got to realize there might be a chance you might have to make a change into a different plan. So this is the most important change. Now, there's some other little bells and whistles you want to call it that were kind of added to Medicare Advantage plans for 2021, for example. And of course, I think a lot of this has to do with the good old COVID 2020, if we want to call it. But they've expanded the telehealth services, so now you can call in more for doctor advice and you're not feeling well, they can kind of prescribe you things versus having to go into a doctor's office, which, let's face it, if you're older, the last thing you want to do is go into a doctor's office and expose yourself. So they've expanded that stuff. They've expanded what they call long-term care coverage. Now, don't look at this as a long-term care policy. So, and I wish they would have reworded this, but this is how they word it, so I'm going by what they say. So, for example, adult daycare service. So if you're a caretaker taking care of someone, these newer plans have now built in adult daycare services so they can maybe watch your loved one for a little bit, so maybe you can go home and sleep for the night and can kind of catch back up. That's a big deal. In-home personal care, that's another thing that's been added to the new 2021 plans. Another benefits, for example, if you have allergies or need cold medicine or pain relievers, or maybe you're on some vitamin supplements, a lot of these newer plans are actually covering that stuff. So you're actually going to have money going towards those things you go into the CVS or Walgreens for. And then I think another good one is the home safety modifications. So things that make your home safer. If you're not doing well, you can't walk around, need some things, maybe you need a chair put in, things like that. A lot of these plans are actually covering a lot of the stuff now, which is kind of neat. And then, of course, the meal deliveries, that's becoming a bigger piece to this, where you're seeing some plans doing more food, free food being delivered to your house, free transportation if you need to go to the doctor's, gym, or go pick up prescriptions, grocery delivery. I thought that was kind of neat. Now they have services that will actually do the delivery of the groceries. They'll pick them up for you and drop them off. Now, one of the bad things is you got to be conscious of is the limits, the out-of-pocket expense limits has actually gone up. It was $6,700 this year. It's going up to $7,550. So know your plan, meaning not all plans are going to have a maximum up to $7,500 or so. Some have less. So this is the time to evaluate to make sure that you're not in a plan that has a maximum out-of-pocket expense, because you're going to see an increase going into next year. So those are a lot of the changes that you're seeing coming right now. So make sure you understand this stuff. If some of the stuff seems enticing to you, go, hey, Kevin, I'd like to look into this with the newer plan. Can you find a way to maybe see if there's something we could change into that could be better to add these services? That's what we're here to do.
So the idea is you let Kevin and the team at Carolina Medicare do the shopping for you, just like he was talking about deliver your groceries. I don't know. Do you deliver groceries? I guess you could. Will you put them away for us too?
Yeah.
No. But those are the kind of things. I mean, a lot of new things happen all the time in Social Security world, in the Medicare world. You need to stay on top of that. Kevin and the team at Carolina Medicare are here to walk you through these changes and make sure that you still have the right plan. That's why the open enrollment period runs October 15th through December 7th, because there's certainly a lot of people on Medicare, and there's a lot of people that do need to make changes. Some don't. Most probably do. But Kevin and the team are here to help. Remember, you're not paying Kevin for his guidance. The insurance companies do that. 843-868-MEDI, 843-868-6334 is the number. No cost, 843-868-6334. I read online that there's a star rating for Medicare Advantage and Part D plans. What does that mean for Medicare beneficiaries?
Well, first and foremost, this has nothing to do with like the movies, so it doesn't mean that it's better plan to look at, for example, right?
It's not a five-star, resort, five-star hotel, five-star restaurant.
Exactly. So don't mistaken it for that. But really what it's about is that comes out in October, and that's based on the previous years. That goes all the way up to October, and it's based on the experience and the complaints that these companies receive, and all this stuff has to be logged. They can't just hide all these people complaining about stuff. And if I can say anything, I think the 2020 year has been a great time to really test out these insurance companies, because let's face it, COVID came around this year. It's really put a lot of strain on insurance companies not knowing how to handle things, and you can see certain companies got in the bandwagon early, made changes to how they were handling things with their beneficiaries, which, their people around their plans, to make sure they were providing the services they need. So I tell people all the time, I go, looking at that star rating today gives you a good idea how organized these organizations are to make sure they're handling things and getting up with the times. Because over the years, nothing's really changed except for new benefits and things like that. So this COVID thing really threw us through a loop with insurance carriers or standpoints. So looking at that star rating is going to give you an idea how good these companies are handling the experience for these people, and making sure they're having the least amount of complaints from people about maybe things that weren't going right. So that's what that star rating's about. So it's good to know that and understand what it really means and how it's factored in. So that's basically any time before October through the October of 2019 and how it worked out for that year.
So when we think about Medicare, the Part A, Part B, Part C, Part D, and the F's and G's that fall into the Medicare supplements, we have Medicare Advantage, or we have Medicare supplements and Medigap, which are the same thing. What are, these different types of plans? And you mentioned PPO earlier, and I didn't really know what you're talking about. So I need you to explain this to me as well. But what's the difference between HMO and PPO Medicare Advantage plans, and why is that important for us to understand?
That's a big piece of the puzzle that a lot of people don't understand. So when they doing their own do-it-yourself or shopping out there, they don't look at the fact that the plan says PPO or HMO at the end of it, and they join the plan and they go, whoa, I didn't realize what I was getting myself into until it happened. So, HMOs, if you're not familiar with these, are a plan of, it's a network of doctors within a group. So if you're going to your primary doctor and now you have to go in for a surgeon for something, it has to be a surgeon within their network. So if you got a surgeon you like in the area, and if they're not within that network, you're going to have a little struggle getting getting that surgery done. Something that maybe is near and dear to you, that you want to make sure is done right, and you just feel comfortable about Dr. Smith, for example, doing the surgery. That's going to be a struggle for you. On top of that, you still have to get referrals, meaning that your primary doctor has to refer you. They have to say, okay, you know what, you probably need this surgery. I'm going to refer you to the surgeon to do that kind of stuff. So put the little hurdles in there. But the co-insurance stuff is going to be cheaper as far as the maximum out-of-pocket expenses you're going to see in that plan. So it's a give or take, right? If you like to go through a few hurdles, you could save yourself money if you end up having to use the insurance quite a bit for the year. Whereas a PPO is a network of doctors within your whole area. So you don't have to get a referral. You can, if you need to get in for surgery, you can find a doctor you like that's in network. And maybe at that point you can go to the doctor you want to go to get the surgery done. So those are important things for people to understand. So if you decide you want to go on your own and not call our office, you better understand the differences between those things, and you better be looking at the whole plan as a whole to make sure that everything inside that plan is going to cover what you need to cover, doctors and prescriptions and so on.
So could you say that the HMO part is similar to Medicare Advantage? Might be a little cheaper up front, might cost you more down the road, and the PPO is more Medicare supplements, might cost you a little more up front, but maybe a little less down the road? Could we say that?
That's kind of a good way of looking at it. Yeah, absolutely. It's HMOs. I mean, I know in the private sector of the world, HMOs, if some companies offer two different plans, HMO is going to be cheaper, but you might pay more just because you might not be able to go to the places you want to go, the doctors you want to go to, and so on. So sometimes it's not a cost. Maybe it's the convenience of going to who you want. So that's a real big thing. If you want more convenience, you want more flexibility, the PPO is going to be the place to be, but it could cost you more.
Final question for you, Kevin, on the program today, because you haven't even mentioned this yet, and you do it every week. And so I didn't want you to get through this one and not mention it. Why is it so important to look at our annual notice of change letter? You haven't mentioned that yet. Well, that's important, right?
Yep, it's a big deal. Every year, big changes happen inside plans. Prescriptions change constantly inside your plan, or you might be in a new prescription that might not be covered in your current plan going into 2021. So you've got to be looking at these things to see that kind of stuff. I always joke around. It's like NASA, right? NASA plans, has contingency plans, everything in place. They're looking at everything, but when it comes to insurance, everyone kind of pushes this to the wayside. It's just second nature to them, thinking, it's fine, I'm covered, I don't need to do this. You got to understand that stuff. That's what we're here to do. We sit there, we review it, we make sure that you're covered, we make sure your doctors are being covered. And if there's new bells and whistles that can be added to that, why not get something, that could be like free lunch out there, for example, and get what you can get out of it. But that's the most important thing I think that anyone needs to understand. Know your annual notice of change, read it, understand it, and make sure that you're not making mistakes going into the new year.
So here's really what you need to remember. Kevin Geiger and Carolina Medicare are the Low Country's fully independent Medicare advisory firm. They're free of any influence from any insurance companies because they're independent. Their services are always free to their clients, so they're free to you. And the goal is to guide everyone through this Medicare maze. If you have questions, concerns, it's 843-868-MEDI. 843-868-6334. Again, 843-868-6334. You can always go to the website, carolinamedicare.com, carolinamedicare.com. Kevin, enjoyed it. Enjoy the rest of the weekend. Have a great week. We'll do it again next week.
All right. Take care, Mark. Take care, y'all.
This has been Medicare Made Simple with Kevin Geiger. To talk with Kevin, call 843-868-MEDI. That's 843-868-6334. Kevin is also online with your resource on all things Medicare. Visit carolinamedicare.com.